has always been an important point in the global trade route. Our small state has 4 international airports. Hence, it is no surprise that Kerala was the first state in the country to report an infection of the novel coronavirus. Even before it was reported, we were adequately prepared. 24-hour control rooms were set up at the state and district levels. Protocols were issued for health and LSG officials. Early preparedness helped us to successfully prevent local and community transmission from the initial cases. However, by March, COVID had spread to Europe and America. Kerala has a regular flow of passengers from both places, and this created some new challenges. The state government undertook a massive effort to rise up to the challenge. A series of measures like screening of incoming international passengers, contact tracing of positive cases, and quarantining of suspect cases were introduced to respond proactively. In tackling the health emergency, the robust public health system in the state has played a leading role. As far as preventing the transmission of the virus is concerned, it was made possible by the people of Kerala with their wholehearted support to the directives issued by the authorities. The culture of solidarity has been a key aspect of our fight. The Kerala State Drugs and Pharmaceuticals, a PSU, started the production of hand sanitizers. The jails in the state started producing masks. SHGs like Kudumbashree also pitched in. We also did a massive outreach campaign using all platforms, including social media, to improve public awareness on the virus and the disease. All these measures have together made it possible for Kerala to collectively tackle the pandemic. Though government is in the forefront, the credit goes to the whole society as such.
Sure. And with your permission, Honorable Chief Minister, I'd like to mention one thing. This session will be conducted in 2 segments. In this first segment, which you're watching right now, some of the most pertinent questions will be answered by the Honorable Chief Minister in English. And in the second segment, we hope to take more live questions off Twitter feed, where he'll be responding in Malayalam. Now back to our questions. A lot more questions have been asked about how Kerala achieved these impressive results, as in what is the history of it. Has the Kerala model as such helped us in achieving these impressive results? What is your take on that?
The Kerala model is a people-centric model. It focuses on a participatory approach to solve problems. The investments the state has made in human development, especially in health and education, have helped Kerala overcome these challenges. The high levels of literacy have helped us to communicate the risk of the disease to the public. Our public health system is one of the best in the country. It has helped us to provide effective treatment even to those with comorbidities and the elderly. though COVID-19 manifest as both a health emergency and a financial crisis. This pandemic demands the effective cooperation and coordination of many departments. Local self-governments, community volunteers, government officials, police force, and so on have their own roles to play. No effort would suffice on its own. Teamwork is key. We opened community kitchens across the state. Free food was delivered at home for those who needed it. We made sure that we treat them with dignity. Some people might be reluctant to ask others for food, so we started a phone-based system for ordering food. Kudumbashree also started their hotels in which provided subsidized meals. We provided social security pensions. Financial assistance was provided through welfare boards too. We also delivered food grain kits to all families in the state. When we went into a lockdown, we had made a promise that no one will go hungry in the state. We kept that promise. Ever to the guest workers, even to the guest workers in Kerala. Social harmony is also vital. Kerala is a progressive and secular state. The virus does not discriminate on the basis of religion or nationality. We will not succeed in this battle if we stand divided. We are all in this together.
In the context of this pandemic and in the background of the Kerala model, what do you think is that one big learning from the Kerala story?
People's participation, put your trust on people.
Right. So Kerala numbers have astonished the world. You know, we have one of the lowest infection rates, we have low death rates, and so far we have also avoided community spread. Many people would like to know how Kerala achieved these spectacular numbers.
How fast we respond to the crisis is important when it comes to fighting a pandemic. The novel coronavirus spreads fast, so the room for response is limited. The speed at which Kerala has handled this crisis during the initial days has made the difference. Case surveillance, contact tracing, isolation and testing were carried out aggressively. If we look at the data, it is evident that these efforts have helped much. We are now more than 100 days into the crisis. Still, there is no community spread. On an average, more than 75% of the COVID-19 positive cases fail under the import category. It is important that there is no stigma around the disease. Stigma can lead to underreporting, misinformation and lack of cooperation. We used a massive awareness campaign to solve this. Our numbers are a result of the constant focus on the crisis. or a cure for this disease, we will have to continue some restrictions. Physical distancing has to be maintained. We need to be vigilant. Lockdown is an inevitable response to an emergency situation. We are fully aware of the setback to the economy it can cause and the loss of livelihood of many. We have tried our best to resolve these issues by providing additional quantities food, grains and kits having survival items to the people. We believe in a gradual and phased way of relaxing lockdown condition. While the economy has to be activated, the lives of people are too important to be compromised. Consultation with all stakeholders has helped us to evolve the path ahead. Step by step, we are opening up while ensuring caution and care. The patience people have shown is exemplary and deserves a special mention. We will definitely see light at the end of the tunnel. A phased rollback of lockdown is the only rational approach, and Kerala is on that path. We will overcome this challenge, but we will have to be patient.
So, as you rightly said, this challenge is not over yet, the crisis is not over yet. So, do you believe from a broad perspective that Kerala will be able to survive this crisis, and if so, why?
Yes, I do. I believe in the capacity of the people of Kerala. We will overcome this challenge. We will build a better Kerala.
One of the biggest problems that have been, not problem exactly, one of the critical points that have been discussed through these 2 months was about migrant laborers and how a lot of them were stuck in different states. So that is one of the most important questions that has come up repeatedly on our hashtag as well. What would you like to say about that, as a major issue the country is facing during this period?
Kerala holds a large number of workers from other states. We consider them as our guest workers. The term denotes the special place they have in our hearts. We have implemented a series of measures to ensure their safety and well-being during the lockdown period in Kerala. We set up over 20,000 camps providing assistance to over 3 lakh guest workers. Food, sanitation and health services were also provided to them in the camps. We are well aware that something more than meeting their basic needs is required. We started community kitchens at the local government level to make sure that no one is deprived of the basic need for food. Realizing that food tastes and preferences are diverse across the country, we also provided essential food items so that they can prepare their food of choice. We ensured that they get dishes of their taste and preference. Since outdoor entertainments are closed during the lockdown, the government decided to ensure indoor entertainments in the guest worker settlements. District authorities were asked to make arrangements for it, including providing television sets wherever possible and necessary. We are fully aware that even though basic needs are taken care of, there is an emotional problem which the guest workers are facing. Their near and dear others. Kerala is one of the world's largest in times like this. They are.
So, are you optimistic that this crisis, we will tide over this crisis in this year, in 2020?
Yes, I am optimistic. All of us should be. Keep hope alive.
On that very positive note, we'd like to now move into the second segment of our session. മലയാളത്തിൽ കുറച്ച് ചോദ്യങ്ങൾ ട്വിറ്ററിൻ്റെ ലൈവ് ഫീഡിൽ നിന്ന് എടുത്ത് ചോദിക്കാം എന്നാണ് കരുതുന്നത്. അതിലേക്ക് കടക്കുന്നതിന് മുൻപ് ഒരു ചെറിയ കാര്യം പറഞ്ഞുകൊള്ളട്ടെ. ആഘോഷത്തിനൊന്നുമുള്ള ഒരു മാനസികാവസ്ഥയിലല്ല അദ്ദേഹമെങ്കിലും നാളെ 75ാം പിറന്നാൾ ആഘോഷിക്കുകയാണ് നമ്മുടെ ബഹുമാനപ്പെട്ട മുഖ്യമന്ത്രി. അതിനുള്ള ആശംസകളും ഭാവുകങ്ങളും അറിയിച്ചുകൊള്ളുന്നു.
Others. Kerala is one of the world's largest contributors to the talent pool of nurses. In times like this, they are the front line of humanity. So, in a way, we could say that Kerala is fighting this pandemic here and abroad.
So, are you optimistic that this crisis, we will tide over this crisis in this year, in 2020?
Yes, I am optimistic. All of us should be. Keep hope alive.
On that very positive note, we'd like to now move into the second segment of our session. മലയാളത്തിൽ കുറച്ച് ചോദ്യങ്ങൾ ട്വിറ്ററിൻ്റെ ലൈവ് ഫീഡിൽ നിന്ന് എടുത്ത് ചോദിക്കാം എന്നാണ് കരുതുന്നത്. അതിലേക്ക് കടക്കുന്നതിന് മുൻപ് ഒരു ചെറിയ കാര്യം